Hi, we are talking about an important topic that many men overlook because they are busy with work, family responsibilities, and everyday stress. However, certain changes in your body can act as early warning signs that something may be wrong with your overall health. Let's get into it. In the first thing is decline in morning erections. One of the first signs that should never be ignored is a noticeable decrease in morning erections. Many men don't pay attention to this because life gets busy, but regular morning erections are often a sign that hormones, blood circulation, and nerve function are working properly. If morning erections become less frequent or disappear, it may indicate like low testosterone levels, poor blood circulation, narrowing of blood vessels due to cholesterol buildup, early cardiovascular problems. This is not something to panic about, but it is definitely something worth discussing with a healthcare professional. And in the next is a loss of sexual desire, means low libido. Another major warning sign is a decrease in sexual desire. Sometimes this happens because of stress and exhaustion. People become so focused on work and responsibilities that they lose interest in intimacy. However, low libido can also be linked to following problems like low testosterone, depression, anxiety, poor sleep, repeated sexual difficulties that affect confidence and self-esteem. If your interest in intimacy has significantly decreased, it may be worth investigating the underlying cause. Increasing belly fat, that's the most important to be noticed. So let's talk about the belly fat, especially visceral fat, the fat that accumulate around the internal organs. A simple way to assess your risk is to measure your waist circumference and compare it to your height. So the formula is a waist to height ratio above 0.5 may indicate an increased risk of health problems that can be calculated very easily. Excess visceral fat can indicate low testosterone levels, increase estrogen levels, reduce muscle mass, cause fatigue, decrease sexual desire, increase the risk of diabetes and heart disease. This is one reason maintaining a healthy weight is so important. So the next point is signs of insulin resistance. Insulin resistance is often present years before diabetes develops. Possible signs include darkened skin around the neck, dark patches under the arms, weight gain around the abdomen, fatigue after meals. Insulin resistance can eventually progress to prediabetes and type 2 diabetes, both of which can negatively affect sexual function and overall health. And the next point is mental health, and the point that carry that does it matter. So let's discuss something that doesn't get enough attention: mental health. Symptoms such as persistent sadness, low mood, loss of motivation, lack of enjoyment in life, poor sleep, anxiety, and depression. All these signs can have a major impact on sexual health. When anxiety and depression are present, sexual desire often decreases, confidence may drop, and erectile dysfunction can become more common. Mental health and physical health are deeply connected. So, let's see other important health red flags. Several common medical conditions can also contribute to sexual dysfunction, including high blood pressure, high blood sugar, elevated insulin levels, high uric acid, metabolic syndrome. These conditions often affect blood vessels, hormones, and overall energy levels. So, essential tests to consider. You don't have to carry on very expensive tests. So these tests which I'm gonna inform you, all you need to know in accordance with your doctor and healthcare provider. If you are experiencing several of these symptoms, consider discussing the following tests with your whatever healthcare provider or your doctor. HOMA IR, HOMAIR insulin resistance assessment, calculated using fasting glucose and fasting insulin. This helps identify insulin resistance before diabetes develops. And very important is C-reactive protein, CRP, a marker of inflammation in the body, which calculates the inflammation inside the body and vessels. Chronic inflammation is associated with heart disease, depression, blood vessel problems, sexual dysfunction. And testosterone levels, low testosterone can contribute to fatigue, low libido, reduced muscle mass, mood changes. Some optional tests, depending on your situation, your doctor may also recommend prolactin, estradiol, or estrogen. Let's see, in the final goal is not to become worried about every symptom. The goal is to pay attention to your body and recognize early warning signs, attack line in morning reactions, loss of libido, increasing belly fat, insulin resistance, depression, poor sleep, and metabolic health issues can all be signals that your body needs attention. Rather than ignoring these signs, consider speaking with a qualified healthcare professional and getting appropriate testing. Prefer always organic way of life. Your sexual health is often a reflection of your overall health. Take care of your body, take care of your mind, and do not ignore the signs your body is trying to send you.